My name is Dr. Ravinder Singh Rao. I'm an Interventional Structural Cardiologist, Vice Chairman RHL Hospital, Jaipur, and Interventional Structural Cardiologist at Lilavati Hospital, Mumbai. TAVI stands for Transcatheter Aortic Valve Implantation. It is also called as TAVR, TAVR, Transcatheter Aortic Valve Replacement. The very first TAVI was done in 2002. Since then, TAVI has come a long way. Back in 2012, we were doing TAVI only for patients who were not fit for open heart surgery. But now we have evidence that TAVI is even better than surgery in patients who are even low risk for surgery. So at present, anybody above the age of 65 years, if we can replace the aortic valve or if we can do the TAVI from the femoral artery, it has become a treatment of choice. The advancement which has actually happened is in the durability data of the TAVI valve. Earlier, there were questions whether this valve will last longer or not. Now we have data of almost 10 to 12 years comparing TAVI with surgery that this valve is going to last as longer as a surgically implanted tissue valve. The complications like paravalvular leakage, the pacemaker rate, bleeding, requirement of surgery has drastically gone down. AI or artificial intelligence is coming up in a big way. The way it is going to help us in TAVI patients is with AI, we can predict what can go wrong on table. The way it is done is even before doing the TAVI procedure, we would be doing a CT angiography, and AI is going to help us to implant the valve hypothetically on the software and help us to understand the interaction of the valve on before we even enter the patients. So we would know these are the certain things which we have to be careful when we do the procedure. So it's like we would do the procedure on the computer with an AI and then replicate or implement it on the cath lab table. TAVI has certain challenges when we adopt it in Indian society. One challenge is finding the right patient. A lot of patients would pay from their pocket to get the therapy. There are certain insurances as well as government schemes which cover this therapy. So, at present, our biggest challenge is to create the awareness, educate our colleagues, and make the procedure more safer for our Indian community. It is also our responsibility to prove the data that this valve is durable in our Indian patients as well. Patients, the affordability aspect of the TAVI procedure, now with certain insurances and government schemes also participating and taking care of patients. So finding the right therapy for the right patient at the right time is what is going to help our Indian population. TAVI Make in India has come a long way. I did the very first case of Indian valve in the human beings in 2017. Now we have 7-year follow-up that the TAVI Made in India valve is good. We also presented this data in London Valves, which is one of the largest valve meeting, and showed that this valve is safe and effective. I was the principal investigator of this study as well. Now with TAVI Made in India valve proving its durability, safety and effectiveness and definitely affordability, more and more patients can benefit from it. At present, there are 4 TAVI valves which are approved by DCGI, which is Government of India, which are already being used for patients. There are 3 to 4 more companies which are in the pipeline of making new valves. Once more and more valves are manufactured and once we prove their safety and effectiveness and durability, definitely the prices and the affordability of this therapy is going to come down. The future of TAVI, one important thing is if we can increase the durability of this tissue valve to 25 to 30 years so that patients in their lifespan just get one procedure or at the maximum 2 procedure will be a game changer. With the latest research and advent of Resilia tissue, this has become a truth. In Western world, they've already started using this advanced TAVI valve where the leaflets can last 25 years and it's going to come to India as well. Number one. Number two is how do we increase its utility or usefulness among more and more patients population so they can benefit from it. This can be done by increasing the awareness, Most importantly, also we run teaching programs so that we can teach our colleagues regarding implementation of safe TAVI practices. The important thing about TAVI is how to progress from TAVI to safe TAVI. Now, safe TAVI is very, very important. The latest paper, which is published in New England Journal of Medicine and JACC, which is Journal of American College of Cardiology, clearly shows that the outcome of a TAVI procedure is directly related to the operator experience, the center experience, and the number of volumes which the operator has done. In the early part of career, there are more complications, and in the later part of the experience, the safety of the procedure increases. We have developed the safe TAVI program at Lilavati Hospital, Mumbai, as well as in RHL Rajasthan Hospital, Jaipur, just by doing more and more procedure in a safe and effective manner. We have implemented the SOP, and once the SOP is followed for all our TAVI patients, what we have seen is the outcome is predictable, the success rate is more, the complication rate is negligible, and overall patient safety and experience is excellent. We have the same team which has been working on all our patients since past 5 to 7 years. That is very important. We avoid attrition in the TAVI team to make sure that the procedure is safe.